Nurses Day. The 12th of May marks the anniversary of Florence Nightingale's birth. Well, for more on how this day is being commemorated in South Africa, we joined in the studio by Simon Hlungani, who's the president of the Democratic Nursing Organization of South Africa, DINOSA. Simon, good morning and thank you very much. Congratulations, I guess, are in order, as today I'm sure we are honoring and paying tribute to the sterling work that's done by nurses in South Africa. But there are challenges, I'm sure, that you guys are facing even as you are celebrating. Is there a lot for a South African nurse to celebrate in 2017?
Well, thank you very much for having us and the opportunity given. We want to think that there is a lot that nurses of South Africa must celebrate. And in the celebration, we celebrate the strides that we have made and the road that we traversed, the challenges that we have been throughout these challenges that we have in the country. So there is indeed a lot that we must appreciate.
What would you highlight?
One is that our profession is still the backbone of the healthcare system itself. The other is that we have managed to transform from the previous arrangements to the current arrangements, where predominantly nurses have to be and are assisting in rural areas. So we want to celebrate that. But most importantly, the contribution by nurses of South Africa who contributed to the increase in the life expectancy of people of South Africa, especially in the area of HIV treatment, when we started providing and initiating through what we call NIMART, the treatment of HIV and AIDS. It led to the increase from the life expectancy of 53 to currently the years of 62 of individuals in South Africa, which is a massive improvement over a short period of time. So that's one thing that we must definitely celebrate as a profession. But also we're still standing, just as any other professions are standing in South Africa.
Is there a difference between a nurse in South Africa today who works in a private facility and the one who works in the public facility?
Well, the difference is the working conditions. The persons are not necessarily different.
And the qualifications?
The qualifications are not the difference. But what you can find is that in a private sector, often some of them, they utilize subcategories, where you find that in a setup of an ICU where you have a ventilator, people who must use or nurse the ventilator should be professional nurses. We have seen in the private sector, sometimes they do shortcuts and utilize junior categories such as the staff nurses, and sometimes you get the enrolled nursing assistant who are not supposed to be nursing in that area. And in the private sector, in the public sector, you find that the very same nurse who would be working in the public sector at times do go and work at the private sector. It will be the same people in terms of qualifications. And
there was a time recently when we were hearing about nurses emigrating, South African nurses, black and white, going to work in places like Saudi Arabia. And are we still having that loss of talent from the nursing profession?
Well, of late, the research is showing that around 300 are leaving per month, or around about that. So we still have, we know even some of our
colleagues. What's driving that?
Most commonly is the conditions of employment, and you would know that the conditions of employment starts from the remuneration, which is the salaries, the condition in which we function, where in terms of the supply of apparatus, be it basic equipments, be it medication, be it security within the workplace, the infrastructure itself, where you feel like you are not even being supported enough by the management. Currently, we have nurses are not debriefed, even if you experience trauma experiences within the.
Now, what is DINOSA doing to address some of these on behalf of the nurses as an organization that represents the nurses? Are you doing enough, or are you failing to represent the nurses properly so that you can improve some of those working conditions like remuneration?
Yeah, recently we have made a massive point where we marched to the Department of Health and we listed the areas that we want an urgent revamp of areas. And it's all these areas that we have spoken about. We can talk about the remuneration, where we even included the issue of addressing rural allowance for subcategories. We have spoken about the small issues such as medication that is running short in certain areas, particularly in the rural areas. So we have made that massive input, and we've got a concession from the side of the minister and the department, where they've made a concession to say they want to address those things, and we're still going to have continuous meeting and saying these areas we must must address. OSD is what we call occupation-specific dispensation, which is a salary framework for nurses in South Africa. We have an agreement that we must review that policy so that we can address these other areas that are causing people to move and migrate out of the country, because we need them the most.
Yeah, very briefly as we end, Simon, I mean, it's one thing to get that commitment from the Minister of Health, Dr. Aaron Motsoaledi, and other officials, but every month you said you're losing about 300 nurses to other countries who are professionally qualified here, whom we've invested in. How much longer can you wait to get the resolution? Are you putting enough pressure to get this resolved sooner than later?
We believe we are, but what we want to do is that the minister must act, or we must act together in a manner as if we are a bit insane, you know, where we do a massive shift from what is available into something new. We have seen that in the past when we had the likes of the President Mbeki, where when we pleaded for something, he immediately said it's going to happen. What then happened is that there was a way of staggering and planning towards that. So we want the minister and we want the department to arrive at that instance. And we also want the private sector to improve as well when it comes to nursing care. Because what is at stake here is the profession and the profile of the profession in general. So we must make sure that we deal with that.
Simon, thank you very much.
Thank you very much.
On this day, and you continue to care for the patients in all our hospitals.
Thank you very much.
That's Simon Hlungwane, the President of the Democratic Nursing Organization of South Africa, DINO.